favorable epidemiological data and guidance from our scientific experts has led to a phased plan of gradual lifting of restrictions in 4 phases, guided by our epidemiological trends and active contact tracing. Phase 1, which started on the 4th of May, will see resumption of construction, non-urgent healthcare and schools according to renewed directives. Phase 2, which will start on the 21st of May until the June 8th, will see the reopening of some food and beverage outlets, other retail businesses with strict physical distancing and hygiene protocols in place, and mandatory wearing of surgical masks in enclosed public places
Honourable
for employees.
Minister, my
with strict
apologies, we will
supervision
have to
carried out.
move on with the
Phase
list of
3,
speakers.
which will be from the 9th of June until the 13th of July, calls for reopening of large commercial places, centres, hotels and airports. Resumption of activities will be in line with directives and continued favourable epidemiological data.
Thank you, Honourable Minister. We now go to Finland. Your Excellency, you have the floor.
Honourable President, Director General, delegates. Finland aligns herself with the statement of the European Union and its member states. To complement those messages, I would like to take a forward-looking approach. When this pandemic eventually ends, the world will look different. The toll on public health, the economy, and the society are beyond anything we have predicted. Yet, I want to be optimistic. I believe we have the power to translate the commitment to global solidarity into actions and build back better. We can do this by ensuring that health workers are kept safe, the most vulnerable groups are protected, the vaccines are common goods for health, inequity is countered through social security, and businesses are supported. It is imperative that we base our actions on a right-based approach and use a gender lens. We already know what works: universal health coverage and strong health systems, health in all policies approach rooted in evidence and impact evaluation, preparedness through essential public health functions, and taking a whole of society approach. We also have new tools that will help us get there. We can boost health systems through digital solutions and technological innovation if we mind the issues related to rights, ethics, and data protection. If we resolve to take a more comprehensive approach to recovery, we can avoid the pitfalls of past recessions. The economy of well-being can lead the way to a socially, economically, and ecologically more sustainable recovery. Thank you.
Honourable delegates, I would like to take this opportunity to remind everyone that during this session, speakers are taking the floor according to the list that we have established. For remaining speakers, kindly observe the time limits for the length of statements. There are still a number of speakers left on the list for today's session. In this case, it's not necessary for delegations to raise their flag at this time. Nonetheless, we have noticed that several flags are raised, and I would therefore like to ask that flags be lowered. Thank you for your cooperation and your understanding.
Thank you, Madam President. We would now like to invite Pakistan. Your Excellency, you have the floor. We are moving on with the list, and we would like to invite Nauru to deliver a regional statement. Your Excellency, you have the floor.
Director General of the World Health Organization, Dr. Tedros, Excellencies, Honorable Ministers, Ambassadors, ladies and gentlemen. I am honored to address the 73rd World Health Assembly on behalf of the Pacific Island countries, namely Cook Islands, Fiji, Kiribati, Marshall Islands, Federated States of Micronesia, Niue, Palau, Papua New Guinea, Samoa, Solomon Islands, Tonga, Tuvalu, Vanuatu, and my own country, Nauru. We extend our warm greetings to you all from the Pacific. As of today, there are 273 confirmed cases of COVID-19 reported in the Pacific: Fiji, French Polynesia, Guam, New Caledonia, CNMI, and PNG. The rest of the Pacific are still free of the coronavirus. We have not been idle. In fact, the Pacific health ministers met more frequently than ever since early 2020. We met once a week to discuss how we can prepare and respond to COVID-19. Each of our countries has unique customs and traditions, but share many characteristics. Relatively small populations dispersed across vast distances. That means we face many common challenges in dealing with COVID-19. Working in solidarity, we focused on a common framework of health sector preparedness and response plan for the Pacific. We inventoried the capacity of our health systems, including technical capacity on critical preparedness, readiness, and response actions for COVID-19. Critical laboratory and medical supplies, personal protective equipment, and worked with partners to address the gaps we could without any delay. It is one of the most challenging tasks we are dealing with in the Pacific, and many of us started to implement border restrictions early on to avoid importation of the virus. In my own country, Nauru, our key challenges are geographical isolation, small healthcare workforce, a small critical care units, and communal living family arrangements that can easily fuel local transmission. For the Pacific, as countries start to implement tighter border restrictions in our region and globally, it became harder to send samples for testing, harder to send critical samples in. We subsequently agreed to form a humanitarian pathway, a mechanism that enabled the provision of medical and humanitarian assistance from regional, international, and development partners in a timely, safe, effective, and equitable manner. Moving forward, our Pacific Island countries are preparing for what is going to be a new normal. We have urgent, unfinished business such as building strong health systems, closing immunization gaps we cannot ignore. And there are emerging issues that demand our attention in the new normal. The COVID-19 pandemic is a global health emergency of unprecedented scale. It poses a real and extreme danger to the health and security of the Pacific people. In this time of crisis, we gather, albeit virtually, with our Pacific family to work in solidarity and with the continued support.
Thank you, Honorable Minister. We invite now Antigua and Barbuda to deliver a regional statement. Honorable Minister, you have the floor.
Director General, Excellencies, ladies and gentlemen, it is my honor to deliver this statement on behalf of the delegations of the Organization of the Eastern Caribbean States and Barbados. The Eastern Caribbean region watched the global pandemic of COVID-19 unfold, and with great concern, particularly because of the high risk of severe disease related to our high burden of chronic and non-communicable diseases. When the first cases were imported, the region took swift and decisive action to contain the spread of the disease, relying on basic public health measures of hygiene, quarantine, detection, contact tracing, isolation, physical distancing, and travel restrictions. Allow me, Mr. President, to pause and recognize the dedication and courage of our healthcare workers who served on the front line, especially our nurses and our doctors. Containment works. All countries in the region were able to flatten the curve. However, the needed response to the public health crisis has resulted in the related unprecedented economic and social crises. International travel restrictions and strict physical distancing protocols have devastated tourism and other economic sectors. On average, tourism contributes over 50% of GDP and nearly 40% of employment across the region. Given the interconnectedness of our economies to countries in Europe and North America, our ability to respond to the pandemic is inextricably linked to the success of measures taken outside our shores. The region's response is further constrained by a fragile macroeconomic climate and high levels of external debt, contraction in donor support, and the threat of natural disasters. We are still recovering from the devastating impact of hurricanes in 2017, and the new hurricane season begins in 2 weeks. Mr. President, to ensure our small states are not left behind, the region calls on global partnership in the spirit of solidarity to address the following needs of COVID-19 and beyond. 1. Access to financing and debt forgiveness to allow the region to effectively address the fallout of the pandemic and to support vulnerable populations, households, and businesses. 2. Continued support of PAHO and WHO to strengthen health systems and support transitioning to appropriate technologies, including digital and telemedicine solutions. 3. Access to currently needed supplies for COVID-19 response and equal access to emerging rapid tests, medicines, vaccines, and technologies. And 4. Development of relevant protocols for reopening of the economies, including the hospitality and cruise industry. At this time, Mr. President, we would like to take the opportunity to thank PAHO and several regional agencies in the Caribbean community, including the Caribbean Public Health Agency, CARFA, the Caribbean Disaster Management Agency, CDIMA, the Implementation Agency for Crime and Security, IMPACT, the Regional Security System, RSS, the University of the West Indies, UWI, for their continued and invaluable support. Mr. President, I thank you.
Thank you, Honorable Minister. We would like to invite Mali. Your Excellency, you have the floor. Your Excellency, we don't hear you. Can you please unmute and start again? No, we still cannot hear you. Distinguished Minister, we will come back. We invite Togo now to take the floor, and we will work with you to resolve these issues. Your Excellency from Togo, you have the floor.
Monsieur le Directeur,
Director General, Ministers, distinguished colleagues, distinguished guests, we must cherish the memories of all of those who have lost their lives in this current COVID-19 pandemic. We hope that all of those who are currently sick will get better. Director General, the government of Togo congratulates the WHO on its leading role in organizing the response to the COVID-19 pandemic through specifically technical and financial support, but also, and most importantly, through the different guidelines that it has been publishing as its knowledge of the pandemic has increased. Similarly, I would like at this juncture to pay tribute to the other international organizations such as the African Union, as well as regional organizations, as well as fraternal countries and those countries that have given. They have supported us in different ways throughout this pandemic. Since the very beginning of the different warning centers were sent on this pandemic and the threat that it would represent for all countries, a crisis committee, which was led by the head of our state, was set up in my country. Appropriate measures were taken to protect our population and to stop the spread of the virus. These measures were trying to strike the proper balance between protecting people's health, protecting the economy, protecting people's social rights, and respecting, of course, human rights in all of their different manifestations. Thank you very much for your kind attention.
Merci, Monsieur le Ministre.
Thank you very much, Minister.
We are going back to Mali. Distinguished Minister, you have the floor.
je ne sais pas qui avait gardé son appareil, non? Hein? C'est la technique. C'est chez eux?
It seems we still have technical problems with Mali. I will now like to invite Haiti. Honorable Minister, you have the floor.
Prendre la parole au nom de la
I'm taking the floor on behalf of my government. Madam President, Director General of the WHO, Excellencies, ladies and gentlemen, allow me to send to you the warm greetings of the President of Haiti. Haiti aligns itself with the declaration that has been made by Djibouti on behalf of the French-speaking group. Madam President, like most countries, Haiti has adopted a number of measures to prevent the spread of this pandemic. And before the illness reached our country, our authorities had developed, according to the WHO's directives, a response plan. On the 19th of March, following the emergence of the first case, they decided to decree a state of emergency throughout our national territory. Similarly, a scientific body was set up, as well as a multi-sectoral management commission. A number of measures were set up, and some restricting measures were strengthened, and additional resources were mobilized to implement the plan. To date, we have, however, we must recognize that there are, of course, a number of weaknesses in our health system, and therefore the country has not been able to face the numerous challenges presented to it by the pandemic. International solidarity and cooperation are more necessary now than ever. Madam President, this COVID-19 pandemic has underscored the need to have strong health systems which are resilient and which are linked on based on international solidarity, and which are directed at world health and universal health coverage. In this regard, Haiti fully supports the international platform which would accelerate the development of and distribution equitably of tests, vaccines, and treatments, as well as the strengthening of the health systems for the most vulnerable. My delegation would once again like to make a plea in favor of including Taiwan in the discussions of the WHO. It should not just be an observer. Today, we have to ensure that we can strengthen our world health system. The interpreter apologizes, the speaker is not audible.
Haïti est convaincu que par la commun de nos et de nos connaissances, nous arrivons à surmonter cette crise sanitaire mondiale sans précédent. Merci de votre attention.
Thank you very much for your kind attention.
Merci, Monsieur le Ministre. I would like to invite Maldives. Your Excellency, you have the floor.
Director General, my fellow Ministers of Health and other representatives from member countries, Chairperson, Assalamu alaikum and warm greetings from Maldives. At the very outset, I wish to state that in this time of an unprecedented global public health crisis caused by the COVID-19 pandemic, peoples and nations, and above all, we Ministers of Health need to stay ever more focused, resolute, and lead the efforts to overcome this calamity. For countries as well as for WHO, This crisis has taught many lessons that no country or the world could predict a crisis of this nature or magnitude, that the less obvious consequences or collateral can be as impactful. As countries exhaust all their resources and energy on COVID-19, there may be other neglected health issues and health system needs, as well as socio-economic fallout from this crisis. Therefore, in my opinion, we need to look beyond and the aftermath of the pandemic. Another important conclusion we can draw from this crisis is the importance of health in all spheres of life, be it economy, be it environment, or any other aspect of life. The primacy of health cannot be undermined. When the world is faced with global health crisis, it is all of humanity that suffers. Mr. Chair, just like other countries, and despite early and rigorous efforts, Maldives was unable to prevent it from our shores and had to face its consequences. On one hand, the freeze on tourism activities and fishery exports were affecting our very livelihoods, while on the other, manufacturing countries were placing embargoes and global movements of goods came to a grinding halt. This affected us badly, impacting our containment efforts as well. Medical and other supplies were becoming very hard to procure and import. Here I wish to laud and appreciate the regional leadership by WHO Regional Office and bilateral assistance from neighboring countries, particularly that of India. And although not from our region, we also wish to note the assistance from China. Maldives, China has enjoyed decades of cooperation based on our commitment to One China policy. Indeed, we can contain this pandemic only through regional and international cooperation, and when all countries start working together and sharing critical information and resources. Viruses do not recognize borders. Together as one world, we can overcome COVID-19. Thank you.
Thank you, Honorable Minister. I would like to invite Brunei Darussalam. Your Excellency, you have the floor.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. Mr. President, Vice President, Honorable Ministers, Director General, ladies and gentlemen. On behalf of the government of Brunei Darussalam, I wish to extend our sympathies to all who have lost loved ones and express our solidarity with those affected by COVID-19 and the healthcare workers and frontliners who work tirelessly to combat this. Since the start of the outbreak, we have detected a total of 141 cases and reported 1 death. Thankfully, through a careful program of testing, contact tracing, isolation and treatment, we have managed to control our first few clusters. Although the battle is not yet over, I wish to share 2 lessons from our experience in responding to COVID-19. First is the importance of enhanced surveillance and testing. We are an early adopter of testing in absence of symptoms, and we also conduct random sampling in community health centers and among the foreign worker population. Our test per capita ratio is among the world's highest, and we believe that containment efforts have been crucial in preventing widespread community transmission. Second, we established an effective community engagement strategy with daily press conferences, a dedicated 24-hour hotline for public inquiries, and a self-screening mobile application integrated with artificial intelligence and data analytic capabilities. Civic society has played a key role, and a significant grassroots movement sparked a surge of volunteerism and community advocacy. Our emphasis on containment along with community engagement has allowed us to control the disease without resorting to whole-scale lockdowns. Although we have implemented some level of moderate physical distancing, public services and businesses remain open and no movement restriction within the country have been imposed. As such, this combination of targeted approaches can be a useful way forward in the months ahead. Adopting a phased approach to de-escalation and leveraging technology for swift contact tracing could be a viable strategy to sustain the response to COVID-19 pandemic. We stand ready to work with WHO and the global health community on this important issue. Thank you.
Thank you, Honorable Minister. We would now like to invite Paraguay. Your Excellency, you have the floor.
Señor Presidente.
Distinguished President of the WHA, Member States, WHO Director General, this year's assembly is taking place in an extraordinary context, and Everybody needs to pull together to face up to this pandemic, which means that we need to rethink our healthcare systems and rethink the reintegration of our peoples. We in Paraguay have taken drastic decisions very early in order to combat the pandemic. We recently experienced a dengue epidemic, and therefore the healthcare system was extremely fragile anyway and involved in a reform process. But we focus on the value of life. And current figures show that the decisions that we've taken have been the right ones. But the situation is extremely difficult. We need to emerge from lockdown gradually, and we need to use intelligent, smart quarantine. We need to ensure that we don't make mistakes at this crucial time. The people of Paraguay has supported the government in this approach and is promoting a new series of lifestyles. And what's absolutely vital is that all stakeholders are involved. We need to include prevention as well as efforts to combat the pandemic at borders. We need to ensure the full participation of Taiwan in the World Health Organization. A status observer would enable them to come here to the Assembly and share their experiences with the world. So we need to fight this pandemic together. We need to do our utmost to support the health of our peoples. We know that humanity needs to find fairer and more effective ways of living together and growing together. Thank you very much indeed.
Thank you, Minister. We would now like to invite Pakistan. Your Excellency, you have the floor. We will continue with Ethiopia. Honorable Minister, you have the floor.
Thank you, Chair. Ethiopia commends the Director General for his inclusive report on COVID-19 and highly appreciates the fundamental leadership role of WHO in coordinating the comprehensive global response to the COVID-19 pandemic, as well as supporting the national response efforts of member states. The dedication of WHO leadership and staff demonstrated is to be highly valued rather than undermined during this crucial moment. Excellencies, distinguished delegates, the increased adverse impacts of COVID-19 pandemics on the lives of people and in the fabrics of society around the world is concerning. The virus is not only attacking the health of our people, but also devastating economies, social and cultural lives, and affecting our way of living at large. This is why the COVID-19 response requires a whole of government, a whole of society approach at national level and increased collaboration and support with a spirit of solidarity at the global level. Ethiopia calls for universal, timely and equitable access to quality, essential, affordable and efficacious health technologies and products, including vaccines, diagnostics, therapeutics and protective equipment. We call for the removal of all kinds of legal, policy, or technical barriers that impede access. Since the first case was identified in Ethiopia on March 13, 2020, the government of Ethiopia took decisive measures, multidimensional measures to contain the spread of the disease in the country. Ethiopia is also actively contributing to the continental response through ensuring timely distribution of test kits and protective equipment to the African countries in collaboration with WHO, Africa CDC, and our partners. Ethiopia is committed to continue working closely with our neighboring countries to control the spread of this devastating disease in the region. I would like to conclude by reiterating that the only way out of this unfortunate and dreadful situation is collaboration based on respect and solidarity. I would also like to emphasize the instrumentality of WHO's leadership in order to overcome the challenge and to recover quickly by adopting to the new norm of global health security and health diplomacy. Thank you.
Merci, Madame la Ministre.
Thank you very much, Madam Minister. You have the floor, Your Excellency. Gabon.
Madame la Présidente, la délégation.
Thank you very much, Madam President. Our delegation congratulates you on your election to the head of the 73rd WHA and welcomes this World Health Assembly in its virtual form during this horrible pandemic period. Madam President, Gabon has, on the 12th of March 2020, had its first case of coronavirus. The head of the state instructed the Prime Minister and the government to work together to come up with a response to COVID-19. Hence, a steering committee for a response to the coronavirus was set up, and there were 2 technical commissions which were set up to lead the different interventions throughout the country. They were working with the scientific committee, which was also set up. They were ensuring the basic health services would continue to function during phase 4 of the epidemic. Gabon adopted a number of measures, both health measures, security, social, economic, and other measures in order to mitigate the impacts at a local level. With regard to health measures, the focus was on mass testing as well as taking care of those who fell ill with COVID-19, as well as active research of contacts of those who were infected and confinement of those who were at risk. And of course, last but not least, protecting health personnel and taking protective measures. Madam President, COVID-19 is not just a health crisis, it's a socio-economic crisis. That will require us to think of the supply chain, have a paradigm shift in our economic model, and rethink international cooperation. Coronavirus will show us the way forward. We have to rethink how we manage our resources. This gives us an opportunity to plead for preventative measures to be taken against COVID-19 and that people universally share any measures taken. There is, of course, a need to find a remedy to this disease. Specifically for developing countries in Africa, because it is an issue of health security and something that can affect all of humanity. Lastly, Gabon welcomes the work of all partners who are committed to come up with a response to COVID-19. And we salute the work of the Director General of the WHO. Thank you very much for your kind attention.
Merci, Monsieur le Ministre.
Thank you very much, Minister.
Invite Belarus. Your Excellency, you have the floor.
Господин председатель.
President, the coronavirus pandemic is a serious threat to world health, and its fallout, political, economic, and social, is something that impacts everyone. That's undoubtedly the case. The pandemic is not yet over, and yet we're already discussing lessons learned. We'd like to draw attention to 3 of them. The first is that the pandemic has demonstrated that there is no unity and solidarity throughout the world, which would have allowed us to come up with a quick response to this crisis. And this is a fitting result to the current geopolitical uncertainties that exist. The president of Belarus, Alexander Lukashenko, proposed a way out, which would be a global dialogue on security. And this would lead to more constructive international relations. This would allow us to come up with an effective response together to deal with transnational threats. The second point is that the pandemic has demonstrated a need to have an effective global governing body, which is, of course, here the WHO. We are convinced of the need for further strengthening of the WHO and its response mechanisms to allow it to respond to world health challenges. Thirdly, the national context is an important factor in developing a key response to the crisis. We're convinced that Belarus has taken the correct course of action, and we were able to keep the government up and running, including keep the economy in good shape, while ensuring the maximum protection for our people. We were providing needed medical care under very difficult conditions, and we prevented the uncontrollable spread of the virus thanks to maintaining efficient health and epidemiological control measures, which have worked to be an important factor to stop the spread of the virus. We've been able to find and locate outbreaks and temporarily isolate those contacts of people who were possible infection spreaders through widespread epidemiological investigations. And that work was done before we even had the first case. This has allowed us to maintain the level of medical supplies and medical care even under the pandemic. We do not have a total lockdown in our country. However, all of the scientific and proven measures that were recommended by the WHO have been used in our country. We have been able to reach one of the lowest levels of fatality, less than 1% in our country. And a number of countries who are now exiting the quarantine period are beginning to follow the course of action that was originally suggested by Belarus. Allow me to express the hope that today's irregular session of the WHA will lead to a paradigm shift in fighting the pandemic. I thank you very much for your kind attention.
Sure.
Thank you, sir.
I would like to invite Angola. Your Excellency, you have the floor.
Excellency, Madam
Your Excellency, President of the WHA.
Delegate, this year we are in a different way in a very complex sanitary and economic context that requires our countries individually and collectively to find innovative and pragmatic strategies to respond to the challenge ever experienced in the recent history of humanity. Excellency, Angola, like the other countries, is in a demographic, epidemiological, and economic transition, with the health having several challenges in parallel high level of with the Republic of China. The country started in February this year implementation of clinical prevention and preparedness against COVID-19. As soon as it became aware the occurrence of major in that country, the executive, under the high direction of our President, João Lourenço, adopted the National Multisectorial Plan with specific financial resources allocated by the Ministry of Finance of Angola. Initially, the measure consisted of closing borders, banning commercial and private passenger flights from Angola abroad and vice versa, institution of mandatory quarantine with surveillance of passengers and flights, transport of support for healthcare and placing immunological surveillance to suspected cases and their contacts. Also, subsequent measures consist of: number one, declaration of emergency and the publication of decrets. Number two, establishment of a ministerial commission coordinated by the presidential office as well as other protective decrees. We approved with specific measures aimed to delaying the introduction and transmission of virus, the spread of pandemic throughout the country, protecting the most vulnerable population and the function of the economy. Mrs. President, the early implementation of these measures, in addition to home confinement, social distancing, hands hygiene, wearing masks, and extensive information campaigns on the epidemic of others has allowed the situation to be controlled. Today, we are with 50 cases. So far, confirmed 3 deaths, 30 admitted, and 14 recovered patients. The National Institute of Health Research has already proceeded 5,978 tests, but we are very about the community transmission phase because massive testing a challenge. The big challenge is in Angola, the wide screen of population group of at risk for the characterization of community circulation of the virus. We therefore take the opportunity to ask for support of WHO in this area, as well as the strengthening of mechanisms to improve cross-border health surveillance within the framework of international health regulation. I seized the opportunity to express Angola's to the draft resolution of COVID-19 response submitted to the WHA73, as well as to associate ours with statement delivered by the African group and the non-aligned movement, and concord as well with deliberation proposed by the WHO.
Excuse me, Madam Delegate, I must interrupt. I was trying to be very understanding and lenient with you, but you have unfortunately far exceeded the time limit. I must implore speakers to adhere to the time limit. 2 minutes for national statements and 4 minutes for group statements. I do apologize.
Thank you. Thank you very much for that.
Thank you, Madam Minister, and thank you, Madam President. We would like to invite Albania. Your Excellency, you have the floor. We would like to invite Slovenia. Your Excellency, you have the floor.
Distinguished President, Director General, dear delegates, Slovenia would like to align itself with the statement of the EU and its member states. Response to the COVID-19 pandemic has demonstrated that Slovenia has a strong public health system with well-coordinated primary health care and public health program for emergency preparedness and response. Efficiently organized civil protection with strong and dedicated health workforce, including laboratories, helped mitigate the health impacts of the pandemic. WHO external evaluation of the international health regulations core capacities performed in Slovenia in 2017 contributed to improve national emergency preparedness and multi-sectoral approach. Consequently, we perceive such evaluations as an important contribution to the implementation of the international health regulations. We have all experienced many uncertainties in responding to COVID-19. Slovenia appreciates the efforts of WHO in coordinating a global response and is stressing the need for an appropriate evaluation that will contribute to better preparedness in the future. It has become evident that ensuring adequate and equitable access of essential medicines, medical equipment, personal protection equipment, and supplies is crucial. Transparent and inclusive international policies toward the development, manufacturing, and distribution of vaccines and medicines are needed for efficiently responding to the pandemic such as COVID-19. Providing access to new affordable vaccines, medicinal products, diagnostics and treatments in the spirit of global solidarity for all is necessary for our common success. To conclude, COVID-19 pandemic is a huge test for our health systems and societies. We strongly believe that cooperation and concrete action is accelerating implementation of already agreed international commitments is vital for ensuring preparedness and appropriate response in safeguarding health of our populations now and in the future. Thank you.
Honorable delegates, we have been at it for quite a while now. I think it would be good for us to take a short break. I suggest 10 minutes. I will ask the Secretariat to give an indication of who will be the speakers upon our return.
Thank you, Madam President. We will start with Turkmenistan, Slovakia, Austria, Mali, Timor-Leste, Egypt, Sierra Leone, and then we will continue. Thank you.
10 minutes, please.